You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Hey, everybody. Welcome back. It's All the Bees, unfiltered podcast about plastic surgery and a mishmash of celebrity nonsense by myself, Dr. G, and Bree. Hey, Bree.
Glad you clarified, Dr. G. Good morning.
I know there's a lot of Dr. G's, Dr. Gallus, whatever. Anyway, yeah, we just made it back from an Allergan. Well, I went to the Allergan Surgical Skills Symposium, a lot of S's together there on breast aesthetics. It was really good. It was in Vegas, and Bree came along, right?
I did. I accompanied by laying by the pool all day.
And ran
moral
into
support.
a resident that was supposed to be at the symposium, but was also laying by the pool all day, right? So
yeah.
wild.
Well, not all day, just at the end, but yeah.
Oh, he just gave up and went out to the pool.
He's like, I'm out.
Nice. But we did hang out with some lovely ladies that let us join in their private sushi room where we went to dinner for sushi, which was delicious. And then went and did karaoke, which I saw an article in The Cut about it last night when I couldn't sleep. And I was like, oh my God, it's a thing to do these karaoke rooms. So
I wish we could show you some of the videos. I know we can't. You also don't want to hear that. But it was the most amazing, we are so bad. It's so good. Our singing is just so heinous that it's almost really great.
I think I'll just say we're just so bad, period, full stop.
Yeah.
But when you're in these rooms that are, thank God, soundproof, and you can sing your heart out and no one else has to listen to you but the people that are in your room, it's awesome because you can really let loose and sound terrible. But so it was Dr. Jenny Page and Dr. Lindsay Urquia. I'm probably messing up her last name. And then their lovely nurse practitioner, Wanda, and then her sister, another Jenny, who joined us and put up with our singing. Lindsay brought wigs for us to embrace our alter ego while we were singing, and we belted stuff out.
Mid end of karaoke, everyone's flights got canceled the next morning, and there was a small freak out, and then we left.
Yes. And then we left.
Because everyone had surgery on Monday.
Yeah, and it's Saturday night, and we desperately wanted to get back to San Diego and for them to Atlanta, which they did make it back, thank goodness. But it was super fun. Yeah, love to do that again. Fun. Well, today we're going to talk about what you can do under local anesthesia, which is everything or nothing, depending on who you talk to. But we'll break down that. And then we're going to talk about first Instagram at Frownies, which our producer Hannah brought to our attention. And I probably had seen and scrolled past, but this is hilarious.
Wait.
The fact that you can sell these is
instead of Botox.
Well, yeah, it's an accessible way. You basically tape your face every night and massage it, and then go to sleep with stickers on your face. And then if you wear those every night for months, it'll be better.
And this is just supposed to no wrinkles are forming at night.
Yes. I mean, this isn't actually new. I remember one of our old employees, Erin, had cleavage and had those wrinkles that form in between your breasts. And so people would wear a silicone patch thing that would kind of keep your skin from wrinkling at night. So this is the same thing. Will it work? I mean, I guess so if you want to wear plastic tape all over your face every night. And some of these temporary
beauty trends that people do, I watch them and it's they cover their mouths, their face, their their entire body is wrapped up in 5 layers of things. But I'm how far can all that stuff really go?
I mean,
they call it your morning shed.
Do your Botox and not worry about it. You know what I mean? You're literally wearing all these patches at night to tape your face. And then they're not retraining muscles. They're just taping your skin back.
The way you sleep and the wrinkles forming.
I don't know. It just stretches out your skin overnight. And then if you keep doing that every night, but the second you stop, you're going to go back to moving your face.
Yeah. So does it have you're not retraining in it?
Anything? No, I think it's just maybe a hydrating tape.
I'm about to duct tape my face tonight and see how it works.
Yeah, I guess no one's sleeping next to you because I don't even really you're going to do that every night?
I can barely wash my face, so.
Yes, I do. I can attest to that.
we were in Vegas. Okay, in all fairness, I was drinking by the pool all day, and I get into bed and I was like, I don't even know if I can wash my face. She's like, get your ass up and wash your face right now.
Yeah, I can't tolerate that. You have to wash your face. Have to wash your face before you go to bed.
The double drink that Jose was making me by the pool, okay?
That was 8 hours earlier.
He did me dirty.
I think the shots did you dirty. I agree. I don't know who in that group was ordering shots. But I was like, absolutely, you always should be washing your face before you go to bed, especially since we're getting up in 4 hours. So you're not going to feel better at 4:30 in the morning when we had to leave to catch our plane.
No.
But can you imagine also trying to put those stupid tape things on? It literally has to be every night.
No.
Okay.
No.
That's all I'll say. I mean, or you can have a half-hour appointment and be 3 months with no wrinkles.
Amen.
And get an actual glow up.
Amen. Life is too short to not get Botox.
It really is. I don't think, why even have an alternative to Botox? Just do the Botox. Speaking of bad Botox, etc., our favorite show to bash All's Fair.
Watch this.
I know. I did watch probably an episode and a half. I just haven't gotten back to it. Is Jessica Simpson shows up on All's Fair as a botched plastic surgery face, so it's a joke, and they have to make her look insane. Right? That's the premise
Initially,
of the
when
episode.
Initially, when I saw this, I didn't realize that she had prosthetics on for the show. And I was like, oh my God, Jessica Simpson, you cannot come out after all these years looking like this. But no, the whole point of the show, I'm not going to spoil anything for anyone because
there's no plot.
But yeah, it's basically just she has this husband and wants her to look 30 years younger. Otherwise, he's just going to have sex with groupies. So she does all this crazy plastic surgery. All she wanted was Botox, and he made her change her entire body and face. And that was the premise of her acting debut.
Yeah, and so because she changes her face, and then he dumps her anyway, right? So then she wants a divorce.
Yes.
I just think, I don't know, it's interesting for a Kardashian to be involved in this, but
I feel like
no
all
irony.
These divorces are just storylines from their lives that they're just bringing into this. And in one episode, Kim K, so she did not pass the bar, and she put out on Instagram, she's like, well, at least I'm a well-dressed lawyer on the show, not in real life. Homegirl is wearing a thong skirt with her whole butt hanging out. I was like, that would never fly. Imagine showing up to court and your lawyer is just in a thong suit.
Why is there a thong suit? Why are you missing the back of your suit? Let's take a look at Jessica's botched plastic surgery face, because I think we're just looking at her regular face. Yeah. She just looks
worse than that.
It's
on
giving
the show.
MAGA.
Yeah, it was so bad.
Yeah. It's just it's the classic pillow face with overdone lips, overdone cheeks, no tear trough, can't see the eyes, really harsh makeup.
They did a super, super tight and right fox eye lift. Everything was just pulled on the show, pulled and fluffed.
Yeah. I mean, I'm surprised anybody even noticed, honestly, because the outfits on that show are crazy. The whole thing is bananas. But
that whole show is wild.
Anyway, well, all right. Speaking of good plastic surgery, Simone Biles reveals the 3 plastic surgery procedures that she's done. And number 1 was her boobs, which they look great.
I'm
she
surprised.
Looks so cute.
Yeah, she looks, I guess I'm not surprised in that picture. But I was going to say, you can't even tell. So she looks fabulous.
She looks so good. Yeah. So she revealed, I forget, I think it was like Botox. And I feel like one time she mentioned she had Botox and didn't like it though. And I was like, well, you just didn't have it done right. So she had her boobs done, which looks fantastic and
very
good for her.
complimentary to her body.
Yeah.
And a lower bleph.
Like, 2 of them you would never. Oh, that's right. She had a lower bleph, which is wild, and earlobe surgery. So the earlobe surgery is something we do pretty commonly, actually, for either torn earlobes or earlobes
there
were. Oh, yeah. Circling back to the thong suit. What?
Like,
hell?
You cannot show up wearing that. Like, it's like the mullet, business in the front, party in the back. Like, business in the front, Ray J in the back.
It's terrible. It's so outrageous. It's like anyway, I have no words. No words.
If I show up in scrubs and the back of my scrubs is just a thong.
Someone was talking at my thing at the symposium about bringing back the scrub dress. And I was like, what? They're like, I just get hot in the OR. I'd rather have a scrub dress. And I was like, no, I do not want a scrub dress.
That does not sound fun.
If something spills, ugh.
Yeah.
There's that much less between you and the drapes. No thanks.
Our Monday's case was a little messy, and I can't imagine.
Right?
Can't imagine being in a skirt or a dress.
No, that stuff so.
I don't even like that. Like one jumpsuit. Then you have to get fully naked to use the restroom.
Yeah, a scrub jumpsuit's also utterly stupid.
And you really
maybe we should bring a buttless scrub.
I'm gonna do it. I'm gonna just cut up an old pair of scrubs and see how it works.
Scrub. I say.
Yes. I'm gonna do it for April Fools and see how mad you are.
Okay, I like it. All right, let's go back to Simone. She had a lower bleph, which I am kind of surprised because it's not, I didn't think her eye bags were something, but if it bothers her, it bothers her. So, and that's awesome. So she's back to being retired and she's had those procedures. So good for her. And then speaking of this other title, Sam Smith's parents greenlit nightmare plastic surgery procedure at age 13. I feel like the title of the article doesn't
lipo?
Yeah, but it doesn't really. I feel like it's shocking. It's misleading because he makes it seem like it was about his weight and that he talked on a podcast co-hosted by Penn Badgley, who's the guy from You and Gossip Girl, which is on constant replay in my house at some point. He had surgery on his chest. So it's not like he lipoed his, flanks. He had 13 years old, he had a growing chest. So he had gynecomastia. Just say gynecomastia, weirdo. And so he got liposuction when he was 13 because he couldn't swim. He was embarrassed about his chest. He was getting teased. So I don't know what's the nightmare part. I'm confused. Like,
I feel like
you were getting bullied by your chest and you treated it. And then
I just feel like anything at 13, like you're just not old enough to have to recover. And I'm sure take pain meds or whatsoever, you're just not. Like my 13-year-old fell off his bike and got all scraped up, and he was like laid up in bed for like 4 days, unable to like do anything. Like that, it's just you can't recover at 13 years old.
Yeah, I mean, I do think so. Gynecomastia is super common, right? So 2/3 of adolescent males will have some form of gynecomastia, and the majority of those will outgrow it because it's just a hormonal shift. But for some, it's persistent. So I think in the adolescent male, this surgery can be life-changing. But I would say 13 is probably a little early because you're not done with your hormonal shifts and you're probably going to get recurrent gynecomastia. So it really needs to be stabilized. So most plastic surgeons won't do it until they're like 15 or 16 at least. It really needs to be extenuating circumstances because you don't know if you're actually going to hold on to the gynecomastia or if it'll just go away on its own. And then you're just doing unnecessary surgery, or if it's too early, it just comes back. But, if someone's really wrestling with, getting bullied at school and you think it's going to change, I mean, maybe in narrow circumstances you can do it. But yeah, I agree. At 13,
Would you have to take like the glands out? Like what would...
Yeah, they do. I've done
13,
16 or 17. I did one that's lipo only, but in general, you have to do a little bit of excision of the breast tissue that's there. That's just...
This just gives me more of like an eating disorder type of vibe. Mm-hmm. Like he just keeps commenting about how he just couldn't stop eating.
Right, which has nothing to do with gynecomastia, but the fact that he keeps referring to his chest, it's just confusing. But honestly, you know, he's 30 or something now. So remembering what happened to him at 13 is going to be a little muddled anyway. So yeah, it's tough. You want to help your kid. I can understand the parents wanting to help their kid not feel embarrassed or bullied, but then also not create a new problem. All right. So enough about Sam Smith. I don't know why it was a nightmare. Was that he wore a bandage for a year afterwards and he kept eating. Okay. So this is kind of leads into our topic of local surgery, local anesthetic surgery. I'm a plastic surgeon. Why I'd never perform an awake BBL. And so the Post spoke with Dr. McNally, Sean McNally, about the upsides and downsides of being awake. I mean, I know it's Bree's least favorite thing to participate in because patients are either so comfortable and chill or they're not. And you don't really know until you start.
There's like no in between.
Mm-mm. My friend in Tampa does exclusively stuff under local. So awake, you name it, she can do it awake. However, people are coming from all over the country to see her and she's not cheap and she's doing it awake. And so those patients are highly motivated. I think the average patient that asks if it can be done awake assume that it's going to be easy and they're not going to have pain with no insight onto their pain tolerance. And they're looking for cheap. And so this guy, Dr. McNally, says the perks are there's no anesthesia provider and either a reduced or no facility fee, which makes the procedure more affordable. But the trade-off is...
Can I stop right there? Because I have seen so many, even before I met you and I was going to do an awake BBL, it was still more expensive than going under general. All of these that I have seen, none of them are cheaper. They have like astronomical prices compared to going under general with facility, with anesthesia. Like that doesn't make it make sense. The math is not mathing.
No, I agree. I think some places there are chops for cheap liposuction and you can get a great deal. But a lot of times some of these bigger chains upcharge quite a bit. And it's because they need to pay the surgeon out and they need to cover the overhead of having a chain like Sonabella or Air Sculpt. Sometimes the list price is really high and then they give a deep discount, but not always. I think you're right. A lot of times that guy that you were referencing, the skin and skinnier guy in La Jolla, I mean, he's in La Jolla, so his prices were not cheap. It was like $11,000, right? For an awake BBL.
Yeah, I think it ended up being like 13 or something.
That's crazy.
I think I ended up paying $11,000 to go under general, but I was quoted there at like 13 or something. And then we had another person who recently was quoted by like Elite or something. I don't know. But she was like, if I come in 3 days and get it done really quickly, but it was still thousands of dollars more.
Oh, right. Yeah. Where she wanted to do it there. Like they were pressuring her. And I was like, why don't you just come in for your follow-up, girl?
They're giving me $4,000 off if I come in 3 days.
No.
How much is it there? Like it was an insane price.
Yeah. So I would say the cost is not a reason because a lot of times the cost is not cheaper. And also the cost should not be your deciding factor. It should be, is the person certified to do the procedure? What's their experience doing it? Is it safe? A lot of these places, the real reason they're doing it under local anesthesia in the case of the skin and skinnier guy is because they don't have a certified OR. So if you decide not to certify your OR, you can't offer an anesthetic. You can't do IV conscious sedation and you can't do general anesthesia. So what does that leave you? Local. And technically, you should certify to do a local anesthetic procedure, but no one's really checking that.
Can you if you're an ER doctor?
Yeah, there's no... he's not credentialed anywhere. So he's just doing it under local because no one will ever certify him for sedation, right? Like you're never going to get Quad A to certify you because you have to show that you're credentialed to do that. Like that's what happened. There was a pediatrician that finally lost his license in LA or Orange County who was doing liposuction. You're doing all of that awake. Why? Because you can't do it any other way. It's illegal for you to have an OR with anesthetic.
What business does a pediatrician have doing liposuction?
I don't know. What about
Is there a weekend course?
I guess so. So yeah, so that's the other reason is that you're doing it under local because you're not credentialed to offer actual anesthesia. That's very different from giving the patient the choice. And then you best know what those max doses of lidocaine are because that dose is going to get pushed depending on who's doing it and what you're doing to make the patient comfortable. And at some point you hit the max dose and you can't go any further. So do you abort the surgery? What happens is some of these doctors tend to like fudge it a little bit and then, you know, either you don't give the patient any more anesthetic and you have to hold still, or you give them more anesthetic and then they get too much. And those are neither great options because either you're going to be in a lot of pain or potentially if you're going to have a complication from too much lidocaine, it's usually not immediately. It's usually that first 24 hours. So you go home and then have a problem.
There's also a cap on how much you can take out under local. It's
correct. 500 cc's. If you're certified, right?
Versus going under general, which is 5 liters.
Correct. So those guys are already not following the rules because I guarantee they're taking out more than 500 under local.
They are. I have seen the videos, and there is no way you can get a BBL, skinny BBL, whatever, with only taking out 500 cc's. Because keep in mind, also, that's a lot of fluid and a lot of tumescent as well. Like,
right.
What? Half of that is fat, maybe? Mm-hmm. You're going to put 125 in each booty?
Yeah. So I agree. Those are all terrible reasons to do it under local. I think for some bigger cases, I think going under general gets me the best results because I'm not simultaneously worried about the patient's comfort, which you just have to be when they're awake. So if it's a one small area or one area, I'll do it. But I think, you know, people start doing total 360 lipo awake, it's not tolerated. And you would think that the skinnier you are, the less fat for me to take would make it easier, but it's not because what hurts is when that cannula, which is going in to suck the fat out, either gets too close to the skin or too close to the muscle. And so the thinner you are, there's less room for me to get in there and get fat. So every time I touch skin or muscle, it hurts. And even with the anesthetic in there. So often if you don't have a lot of fat for me to take anyway, it sometimes can be more challenging under local. And then some areas are just more painful. The abdomen hurts more, especially around the belly button. So that's the area that usually ends up getting, you know, not as aggressively lipoed because the patient doesn't tolerate it. So you get a little donut around the belly button. So moving on to the $15,000 awake BBL procedure. This is the article references this guy who is, again, not a plastic surgeon. He's a Canadian. Oh, he had Canadian plastic surgery training. Suissa, founder of Sculpt, spelled weird.
School.
This is just a disaster, this place, I think, in my opinion. They do awake lipo, awake BBL, awake breast dog. But again, if you scroll down to the people offering it, they're all, first of all, there's our...
no.
Yes.
I am so sorry.
I can't.
Okay.
I can't. There's one board certified plastic surgeon out of all of them. It's Bellamy, who I'm pretty sure has had some issues. Scroll back up to Ray, though. Robert Ray, who is like
Gregory
never board certified. Dr. 90210. What is happening? Why are his arms oiled up? Why are his scrubs out? Why is his hair? I have so many questions. Why does he have a stethoscope around his neck? Why does he have a deep V
zip
for
down?
his...
I need zip down scrubs.
And the butt. That's our April Fools. We need the cleavage-bearing scrubs and then the thong.
So excited.
I'm going to oil up my arms, man.
Oh, we should have done that for our last staff pictures. We need a redo.
I just can't with these guys.
Bring them back.
So the article in People was about this place and how it's been a disaster.
Oh, and it's in Miami, so we could have led with that.
Right. Well, they have franchises in California. That's how you get Robert Ray. But these people were woefully, I guess, unhappy with the results. And she said that she was back to work and doing fine. But these patients said that it was okay. And then I think the rest of the article is about people complaining about it. And, oh yeah, right. Because my friend Usha comments.
I love that.
Dr. Rajagopal, plastic surgeon in San Francisco Plastic Surgery and Laser Center, who's a good friend of mine. And I just saw her on a Zoom call, actually. It's limited when it comes to larger areas. And that, again, she points out what I've already said, which is some clinics offer procedures under local anesthesia because they might not be board-certified plastic surgeons and aren't authorized to administer general anesthesia. So
I can tell you that first patient picture, there was no way only 500 cc's were taken out.
Right. So
absolutely not.
Yeah. Anyway, this place has been sued multiple times. So they're also part of Mia Aesthetics, which if you see that, I would just run, honestly. MIA Aesthetics, because they also have franchises. So Sculpt is teamed up with them. And they're one of those practices that changes the name every time they get massively sued. So
perfect.
I would just say no. Please vet who's doing your surgery, honestly, is all I can say. So let's talk about local anesthesia some more. What can be done? Well, I would say the easiest thing to do under local anesthesia is something we are doing 4 times this week, which is a labiaplasty. Shockingly, that is hands down, I would not put somebody under anesthetic for that because it doesn't make any sense. Yeah. So the topical anesthesia, the topical that we use, which is a 23/7, is so effective. I feel like you could almost do the procedure with just topical. I'm not suggesting that, but it really makes everything very smooth. So as soon as the topical is on, you're pretty numb. And then, so when I mark and then put the local anesthetic in, the patients literally don't feel anything. And you don't feel anything until I'm done. Sometimes you might have one little twinge, but it's literally like, I feel something maybe sharp, and I just put more local in if I have to, but routinely I don't. And then I put local in at the end of the case so that people have time to go home. And I just saw one of my patients on Monday that we did the week before, and she took the Genavix, which we've been doing, and no oxy. And she's like, I didn't even take all the Genavix, which you just need to take twice a day. She's like, it's swelling, but it's not. So I think that's been working really well. If you want a narcotic-free recovery, you can do that. Obviously, I prescribe oxy.
I tell every patient in the consult, I was like, while it's great if you're really anxious to take one, you do not need one. Right. No one has ever, once the procedure starts, half the people 10 minutes into it are like, have you started? She's like, oh yeah, I've been going. Yeah. It's just the anxiety of laying there thinking about your labia being cut. But it is people do so well. You don't really need anything in office for that procedure.
Exactly.
Be comfy when you get home, but yeah, that procedure, easy under local. It seems so personal. It seems like a terrible area to have surgery on, but it is the easiest.
Yeah, I would say hands down. Yes, we do offer the oral sedative. You need a ride home if you do that. And I think if you're going to be hard to get out of your head before it starts, that's fine to take. But sometimes it just makes people more chatty. Sometimes people go to sleep. But either way, the ones who do it under regular, just straight local, have no issues. Literally haven't had no issues.
a couple patients after taking the sedative that say they want to go to the club right after. They're like, I'm ready to go. I'm like, okay.
And we're like, that's not the effect we were looking for.
Yeah, I was like, should we Uber downtown? No, girlfriend. Go home and go to bed.
Ready to party.
Yeah, it's just like having a couple margaritas. Really good. The margaritas Ivan made me in Vegas. I bet it's like having one of those. Or Jose.
Oh my God. All right. So I would say our second most popular procedure under local for me is implant removal, right? Also fairly freaking easy.
I was going to say that or Abilene.
Yeah. Those are both popular. I would say implant removal is easier to do under local than Abilene. Yeah. Because it's faster.
Short and sweet.
Yeah. I'm going to like numb up your incision and take out the implant and close the incision. And you'll feel some pressure as we yank the implant out. And then you feel immediate relief because that is gone. And then that's it. And you're in a bra and you're out of there. Yeah. Again, you can take the oral sedative if you want, but just need to ride home. And it's mostly just because you're nervous about feeling stuff, which you won't. Abilene, highly recommend the sedative, right? That's our cellulite reducing procedure. Yeah. So I have to inject local anesthetic, that kind of lipo fluid, into your butt and thighs. And then I use a little device to cut the fibrous septae. So the little connections between the cellulite in your skin to the tissue underneath. And I'm cutting those. And there's just no faster way to do it. Like you have to go in, hook, cut, hook, cut, hook, cut. Each cellulite dimple has about 10 to 15 little fibrous septae I have to cut. Then I have to go back through and make sure we got them all. So it's an awesome procedure, but it takes a minute. So it's usually an hour-ish of me doing that. And people just, it's not like it hurts, but you're just tired of staying on your abdomen, like you're laying on your belly and it just gets old. So I think for that procedure, having the sedative makes time go by faster.
100%.
Versed in it. And so you lose a little track of time. So even if it seems long to you at the time, you won't remember it. So I think that one's well worth it. Dr. Chow does a ton of earlobe repairs.
You do not need it.
Local. There's no reason to need it. And upper blepharoplasty also probably don't need it, but if you're anxious, sure, take it. I do notice that if patients are super anxious, their blood pressure is probably a little bit higher. So there's a little bit more oozing while I'm doing the procedure until they realize that, it's not going to hurt. And then they calm down. And the same thing for the eyes. So when you do a blepharoplasty, you can tell if the patient's like nervous because they're just a little more oozy sometimes. So our backup for all of these, if you go down the local pathway and then you really are still just anxious, is Pronox. So we give you nitrous oxide and you can chill out.
A laughing gas.
Yes. Which usually doesn't make you laugh.
No. Not if you're already in pain.
No. What else? Am I missing other stuff? We do Alaclay under local. That's an injectable though.
Yeah, I feel like that's kind of new. So I feel like over the course of doing so much, I would think maybe an oral sedative would be the way to go. It's not, I think it's just a little uncomfortable.
I think because the product itself stings. So once it gets in, it's kind of painful. And there's nothing you can do about it. So you're like, it's burning, but and not for everybody, just for some patients. So that
over
plus
time, they have to change that.
Awake liposuction, I think it just depends on the patient. And we can't do too many areas. Some people do really well.
Some people who I think are going to do, like we did a lipo-only breast reduction awake, and I was like, there's no way this is going to go well. And she didn't even flinch. And I was like, oh, okay. But then you do a really, really small area of lipo on somebody, and it's like the world is ending. And I'm like,
I know. I think they just have to be motivated, and it's not financially motivated, like motivated to do it.
Yes.
Motivated and know that they have a really great pain tolerance. I mean, one of the ways we check that is like when you go to the dentist, how does it go? And people who are like, oh, I have no issues, or I have to get numbed 1 million times to get it really numb, that's a no-go. That's like a good screening. My friend does breast reductions under local. I think we're probably going to offer breast augmentation under local.
I'm just waiting for that one. I can't wait to see it.
I think you can get the breast really numb. So once again, it's all about the patient being comfortable with what's happening. So, but I think we have a good track record of doing things under local. It just, again, it depends on the procedure. And like, I feel like labiaplasty we could do with our eyes closed. It's absolutely the easiest to do. And then bluff maybe next and some other little things.
Bluffs are easy. The eyes numb super well. Ears numb.
I've done otoplasty under local, also fairly easy. Anywho, so when someone's awake, what are they doing? Are we talking to them or?
Yeah. So a lot of procedures, you can come in, you can either hang out, you can watch a show, you can put on your headphones, depending on the area. Of course, if it's like breast or something, you have to put your arms out so you can't be on your phone. But like labiaplasties, podcasts, you can chit chat with us. We have I know our conversation on the podcast is great, but the riveting conversation in the OR is just, super great. I think we go on some really good tangents. We do. Like a lot of gossip. So
let the patient lead the conversation, generally speaking.
Yes. We get some really good information out of it. Like they have great stories.
Yes. I agree with that.
Chit chat, hang out.
Listen to music. We can play music, or you can listen to music on your phones if you bring them.
Yes.
I would say we're probably not the best DJs, but I feel like Spotify does us dirty.
It does. It's rogue. It is. You'll put on like a playlist and it'll all of a sudden go from like, I don't know, for example, like Kendrick Lamar, if you want some hip hop or whatever that is. And then it segues into a queue of like Christmas Meow Meow Taylor Swift. And we're like, what on earth?
Taylor Swift is like in every playlist, no matter what. You put Ludacris radio on. Friggin' there's a Taylor Swift song.
It hears me talk about how much I hate Taylor Swift. It's not a hatred. I just do not like her music. And I swear it puts it on like every third song. It's like, this is what you get for talking crap about Taylor Swift. So local is, you can do a lot of things under local. What other procedures have we done under local?
I'm trying to think. I think, yes. You're going to say something or no?
No.
Okay.
I was going to segue and ask the recovery period for going under or not being under local versus going under general.
So that's a double-edged sword. Your recovery period is faster from a grogginess standpoint because obviously you didn't have a general anesthetic. But does that mean you can go work out the next day? Absolutely not. Just want to say that again. No.
That's what that is another thing is people feel usually so good after. They're like, oh, well, I'm just going to do it. Like, I feel fine. No. Don't do it. Just don't.
So you're still healing from wherever we operated on, and you still need to take it easy for, generally speaking, 2 weeks. So yeah, I kind of want to get my upper eyelids done, but every time I think about doing it and I have to take 2 weeks off from working out, I'm like,
she's the worst. She won't even take like one night off after like Botox or something. You're not supposed to work out. And she's like, well,
I need to
doctors,
have some reason to slow me down so that I can do something because I know
sedate her for 2 weeks,
put me in a medically induced coma, and then I can get everything done I want.
Her version of the things she does in a day is just different than any other human I've ever met. Like her 24 hours is not the same as my 24 hours. Like the things she does, I'm like, wait, what? It is like kind of insane. I don't know if you're just like cracked out every day, but
I'm not.
I'm like barely functioning. And she's like, oh, I've already done this, this, and this, taken 50 kids to school, done a yoga class, read, took a beach walk. I'm like, it's like 7 a.m.
Right. Yeah. I like to keep moving, I guess. Every once in a while it catches up with me.
Are there any... You first.
Jinx.
You owe me a spindrift. Okay, so are there any certain medical conditions or like health history that would steer someone away from having general anesthetic?
Absolutely. So, yes.
Malignant hyperthermia.
For sure, malignant hyperthermia, which is super rare, but you can't have a general anesthetic. Yeah, I think if you have multiple medical problems, it is somewhat safer for you to go under local anesthesia. But if you really can only do local anesthesia, then we have to be thinking about how safe you are for an elective procedure in the first place. So I guess it kind of depends on what it is.
Yeah,
right.
It's true.
And then can you drive yourself home? Absolutely, if you just stay with just strict local anesthetic. If you take an oral sedative, no, you need to ride home. And our oral sedative of choice is MKO, which stands for midazolam, which is Versed. So that's the one that makes you lose track of time, and it's kind of anti-anxiety. Ketamine, which is ketamine, and then Zofran, which is anti-nausea medication. So that combination works really well. We usually give people 2, unless they're teeny tiny, then we give them 1. It's sublingual. It kicks in about 15 minutes, and it's pretty good, effective. But you're still kind of loopy. For some people, it hits really hard. So I usually mark them before we give it to them, because otherwise I don't know how fast it's going to kick in. And then for some people, it barely dents. I mean, they get some effect, but they're still pretty awake. Like I said, ready to go to the club and are feeling pretty good. Either way, you need to ride home. Okay. And then what, awake but comfortable. Are patients aware of what's happening? Absolutely. Mm-hmm. Yeah, you know what's going on. It's just if you take the oral sedative, like I said, you lose track of time and you forget. Sometimes you'll ask me a question and then you'll ask the same question again. Even if it's nothing like, hey, are you taking any vacations anytime soon? And I'll be like, oh, yeah, we're planning this or that. And then half an hour later, hey, are you taking any vacations?
Yeah.
You know, that's when you know. And they're like, I don't think it's working. And I'm like, no, it's working because you just asked me the same question 4 times.
When you keep asking for another one, it's working.
Yeah.
But yeah, super easy. You have no IV. It's not like you're not being monitored.
So because of that, tips are to make sure it's not like a regular general anesthetic where you can't eat anything after midnight and you're not supposed to, just drink maybe a little bit of water. You should absolutely not show up on an empty stomach for this. We want you to have eaten a breakfast or lunch or whatever and be hydrated. And that makes everything go smoother too. Being hungry is not helpful when you're doing something under local anesthetic. And my friend that does really pretty long procedures under local anesthetic gives patients bathroom breaks. It's a pain in the butt from a prepping standpoint because she re-preps them, but she'll often do, most of the surgery or half of the surgery and then let them sit up and take a look at it. And then they go get a cracker and then they go pee and then they come back and they re-prep and they do the other side. I don't know.
I think it just makes sterility super hard, at least coming from like my standpoint.
I know.
Because then you're worried. And then like, are you scrubbing out? Where's the mail? Like everything is just.
I agree.
I don't love that personally as the person that would have to re-prep.
Yeah, I know. I think it's.
And are you bleeding on the floor? Like I remember like what is. You know what I mean? Like you're oozing a little bit.
I kind of want to go visit her and see what happens, but then that means I have to fly to Florida and I'm less excited about that.
Oh, I've never been to Florida. I'll be at the beach.
Disappointed, but yeah. So we could go take a road trip to Tampa and check all that out. But I think the re-prepping, all of that is a little bit tough. And we just had a pretty good lecture about different things that you can do in the OR to prevent infection. One of them is keeping the room relatively warm, like not super cold. I'm like, check. Because a patient being cold is a risk factor for a post-op surgical infection. And that is one thing that Dr. Gruber actually does too, is their room is warm because they're getting a full standing, full body prep, right? But then the other thing is not having a bunch of staff turnover, which I think is a common thing in the hospital where, people are constantly giving the scrub tech a break and the nurse a break. And then there's a lunch break and then there's another break.
Just me.
Yeah. So that definitely, we don't have that issue. But yeah, I feel like it lends itself to that, like who's walking out with the patient and walking back in and all that traffic. But, she has it locked down. So that's great. I'm sure she's super careful about sterility. I know from briefly doing per diem work at one of those places where they do awake lipo, just mostly out of curiosity, that their version of sterility is completely different. Like there's no gowning up and it was kind of, just because you can get away with it doesn't mean you should, I guess, that freaked me out. I was constantly like, I need another pair of gloves. I need another pair of gloves because I don't, like what's happening? So let's see. Anything not safe or practical with just local anesthetic? I mean, anytime we lipo more than one body part, I think my friend does tummy tucks under local. I don't recommend.
We're going to have to talk more about that.
Yeah. No.
Is there a diastasis repair with that?
No.
That would be so painful under local.
I know.
No one would get through that.
No. I don't recommend a thigh lift under local either.
I don't want to be present for anything under local for thigh lift related. I already love our thigh lifts, but
that's just brutal.
Envisioning an awake patient. Yeah, they would not be comfortable.
No.
We would not be comfortable.
But yeah, I think
and all the swearing I do in that procedure, no one would be comfortable.
Right? I mean, just having to listen to us chit-chat. So, yeah. All right. Well, we are going to wrap that up. So local anesthesia is not a no. It's often a yes, but there are caveats. That would be the moral of the story. So if you have a question about it, let us know. If you're thinking about doing a procedure under local, absolutely reach out. If you want to hear more about any of the procedures we mentioned, leave a note in the comments, I guess.
Yeah. Love to hear it.
Scrubbing in.
And scrubbing out.
If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at restoresdplasticsurgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.